So the INTERCHF study stands for International Congestive Heart Failure Study, and the objective was to fill in gaps in knowledge on heart failure patients and their outcomes in Africa, Asia, South America, and the Middle East. These are areas where there is not a lot of information, given that most heart failure research and data that's been generated has come from Western countries, mainly Europe, North America, Australia, and New Zealand. This was an observational cohort study with prospective follow-up. So we enrolled 5,823 patients in 16 countries from 108 sites around the world, and we followed these patients for 1 year. So the main finding relates to mortality. So the primary endpoint of the study was all-cause mortality. And we found that mortality rates varied massively among regions. So we divided the cohort into 6 regions. Region 1 was Sub-Saharan Africa. Region 2 was the Middle East. Region 3 was South America. Region 4 was India, which is a country but a region. Likewise with China. Region 5, it was a country and its own sort of region. And the last region 6 was Southeast Asia. And we found that on unadjusted analysis, the mortality rate in Sub-Saharan Africa was 33%, it was the highest, and in China was 8%, was the lowest. And then the second highest was India at 23%, the third highest was Southeast Asia at 15%, and South America and the Middle East were also low at about 8 to 9%. So we saw large variations. And then we did an adjusted Cox proportional hazards model where we entered 21 variables: demographic variables, clinical variables, medical treatments for heart failure, and socioeconomic variables. And we found that after adjusting for all these factors, African patients still had 4 times the hazard of death compared to the reference region being South America. Indian patients had 3 times the hazard of death within 1 year compared to South American patients, and Southeast Asian patients had 2.6 times the hazard of death relative to South American patients. Whereas Middle Eastern patients, now I should put a caveat, the Middle Eastern patients were 90% from Gulf states, had no excess hazard compared to South American patients after adjusted model. And Chinese patients had no excess hazard of death compared to South American patients on the adjusted hazards model. To interpret them, we have to understand another analysis we did. So we used the explained risk statistic to understand how do we explain the overall risk of death in the entire cohort. And what we found that the entire model, demographic, clinical variables, medications, and region, together only explained about half of the risk of death, meaning the other half is unexplained. So we can only speculate as to what is causing the death in these people. We think environmental factors may be at play, genetic factors may be at play, but also access to healthcare systems, quality of healthcare may differ, healthcare delivery and infrastructure. So these may be factors. So to understand it, we have to say, number one, patients in certain regions of the world that are poorer are much younger when they have heart failure, they're much younger when they die of heart failure, and they die at a much higher rate than in relatively wealthier regions of the world in this study. So this was approximately 6,000 patients, and we've used this information to design a new study called Global Congestive Heart Failure, GCHF, which is going to be a prospective observational heart failure cohort study targeting 25,000 patient enrollment with 2-year follow-up. We're doing it in every continent in the world, so Western countries, Eastern countries, all over the world. And so in this study, we're going to measure biomarkers in every patient. We're going to do a deep analysis of barriers to care. We're going to do much more analysis into the pathophysiology of heart failure and different heart failure phenotypes, and very importantly, a deep analysis of comorbidities in heart failure, which are a major issue. So hopefully we'll be able to fill in some of the gaps or the things we didn't measure or we didn't understand from INTERCHF in this new global cohort study.